All right, so we're looking from the front to the back. This instrument's called a rasp. You can see it's got these sharp points on it. And we're just going to use this to gently roughen up the posterior capsule. This little band right here, you can almost see it. It's right at the tip of that instrument. That's the posterior band of the inferior glenohumeral ligament. And we're going to try and tighten that. I'm just trying to roughen it up a little bit. Basically, you can think about this. I'm trying to make this sticky like Velcro so it sticks together. Lift up on the shoulders just a little bit. Okay, that's good. You can let go. So we're trying to make it like a piece of Velcro just to create a healing response. It doesn't take a lot. We're not trying to take away any tissue. We're just trying to abrade it just like that. See these points, just roughen it up and scuff it up a little bit. There's a little split in the labrum, but that's why if the labrum's not completely normal or if it's deficient, we always use a suture anchor. Nowadays, the suture anchors are so small, we tend to use them more often than we don't. So we'll take a spinal needle next, and we're going to check our angle to place an anchor in. That looks pretty good right there. That's 6 o'clock. That's the bottom of the glenoid down there. So we're going to place our anchor in basically right in front of the labrum here. Looks like we're going to go someplace right about here. So we'll go ahead and make a little incision in the skin. We'll show you some more in a little bit. Pause recording. Pause recording. Anchor. Okay, so here's our guide. We place this right on the edge of the glenoid. We check our position again. We're going to place this right about here. And then we're going to take our suture anchor after we drill. Hold on, let go. I always like to turn it like that, especially when it's not on a chuck. Mallet. Okay, and so now we'll go ahead and back out the inserter. And you can see the ribbons that we have here look good. It's very tight. As I tug on them, I can pull the whole shoulder pretty much. And so now the next step for us is to go ahead and take one of these sutures out the front. So we'll take a pincher tool in the back, a crochet hook in the front. That goes here in the back. Looks like we have to push our there's our cannula. Pause recording. Turn to the right. Grasper in the back. Okay, so we've got one of the ribbons out the front. Hold on one second. Pause. Pause recording. Okay, so here's our suture hook. Remember, this is the band of the inferior glenohumeral ligament that we're trying to tighten. So we're going to start with our hook about here. We're going to rotate back. We're going to get into the capsule here. Can you lift straight up on the shoulder, please? And what we'd like to do, don't move. What we'd like to do is have our suture hook come out right about where you see it making that little bump. Right there, that looks good. We'll go ahead and feed that black wire. That's called the super shuttle. Can you hold the camera now with your hand? We'll hold just like that. And now we'll reach in and grab the relay. Pause recording. Okay, so as we pull back on the relay, you can see how it brings that suture with it. We'll pull it slowly and watch. And there it goes. That looks good. Okay. And so now we've got a couple choices here in terms of suture configuration. I like doing mattress sutures here, but even with that choice, there's several different types of mattress sutures. I think I'm going to do just a kind of a regular mattress suture here because your capsule looks good. We're going to go ahead and take a pincher tool again, and we'll pass this other stitch out the front, the loop crab claw pincher tool thing. Okay, so we'll go ahead and take this and push it over here. And then we'll grab it with the instrument that we call the crochet hook. So now you can see we've got that suture inside the anterior cannula, and we're ready to make another pass with our suture hook. We'll take a grasper in the front. I'm just working on focus right now. There we go. And we'll take a turn to the right suture hook in the back. So again, I'm going to work on focusing that a little bit better. Okay, so this time we'd want to have our suture hook come out right about here. So we're going to start here. We're going to rotate back. Just trying to, again, I'm working on focus. We keep losing. Okay, so we're going to go in right about here. That gives us a good bite of tissue there. And you can see we'll come underneath the labrum right about there. And we'll feed a bunch of that in. Pause recording. Okay, so we've got our stitch here. It's a complex stitch, a mattress stitch, so we're not going to tie a sliding knot. We're going to tie a non-sliding knot. We used to call these Revo knots. It's basically a series of half hitches, just like when you tie your tennis shoes. We do these knots outside the shoulder, and then we slide them down through the cannula. So that instrument you see there is called a knot pusher. We'll put on one half hitch, slide down like that. You see how that tightens that posterior aspect of the joint in the capsule? And then here's the key. We're going to hold tension on that post, and we're going to put another half hitch in the same direction. Make sure the knot is square. And then on the same post, we'll put a half hitch in the opposite direction, like that. And now we'll switch posts and put on two more half hitches. So a lot going on outside the shoulder that we can't show you, but it all is involved in making this knot tight and making the loop secure. And I just prefer to tie knots rather than use a knotless type of anchor for this. So that's the end of that. We'll go ahead and cut the sutures now. Okay. And what that's done is it's tightened up this posterior aspect of the shoulder. It's even harder to see now down the back, which is exactly what we want. So now we're going to work in the front. We'll show you how we do that in just a minute. Pause recording. Pause recording. So we can see here how the labrum's been torn a little bit. This isn't normal right where I'm touching here. It's not detached enough that I'm going to take it all the way down. I think that would be a mistake. I do want to, here, let me show you the move for you. Just do this, just like that. Pull back kind of towards you, not real hard. So the move for me right now is just to use this rasp to gently roughen up this anterior capsule. This is now the anterior band of the inferior glenohumeral ligament, and we're going to place one or even two suture anchors in here. So we want to tighten this anterior capsule here. We're just roughening this up. And so now we just need that green handled guide. We don't need a blunt in it because it's going to go through this anterior cannula. And let's see what kind of positioning we can get here. So we'll take the guide. And with this guide, we can plant a stitch way down here. That looks pretty good there. So we're going to use our drill again. And now we're going to place our anchor. There we go. We'll back out on the handle. And now we have 2 more sutures to work with, just like in the back. We'll pull tight on the sutures to seat the anchor, and that feels really good. So now we're going to take our crochet hook. We'll take out the inferior suture if we can identify it. Like that. We'll pull that out the back here. And now we're going to take another suture hook and make some passes. Pause recording. Okay, so we're just cutting the suture tails from the first anterior anchor, and we're done there. You can see we're trying to balance the joint. So here's the posterior cannula. That posterior stitch is right at the tip of the cannula, kind of down there. You can just see it. There's the first anterior. Already things look tighter. We're going to place one more anchor with a straight guide. And this is going to come in. Again, there's the first one. We're going to place another one right about here. Pause recording. So here's the next suture, or set of sutures. We're going to take one of them out, like that. And now we're going to place a grasper in the back and a turn to the left in the front. You can see we're making good progress here. That's the subscapularis tendon, that thing right there, so we don't really need to go above that. So here's our suture hook. We're going to rotate, do a little bit of a shift by heading inferior, just a little bit like that. We'll go into the capsule. Get a good bite of the capsule like that, and then we'll come underneath the labrum. Almost there. Pause recording. So here's our stitch. We'll go ahead and feed that. We can correct it if it's crossed later. But there's our shuttle relay, that black wire. Pause recording. Okay, so here we are now with another interrupted stitch here that we can tie to further tighten this down. We'll get this tied and show you some more in a minute. Pause recording. Pause recording. Okay, so there's the second anchor. Like I said at the very beginning, you have a relatively small glenoid, but it looks good now. I think we've got things tightened up enough. What I would like to do is we can take sometimes we use a PDS suture just to close that posterior portal. Just get like a number 1 PDS. Our choice is either to close the rotator interval, but your interval is not very open, or we can close this posterior portal, which looks like the thing to do. So we're going to pass a PDS suture through there. Pull out and then take the number 1 PDS. Pause recording. Start. So we've tied that posterior portal up with an absorbable stitch. We just do that to be complete. Make sure the capsule's intact there. And we're going to finish up here. I like that. We've got 2 anchors in the front, 1 in the back. The humeral head looks centered over the glenoid. You don't really have any bone loss, which is great, and hopefully this will do the trick once it heals. So good luck to you now. Bye-bye. Stop recording.